Welcome to your Digital Mentor Podcast. This is your sometimes host, Dr. Christine Boynette. As we begin to wrap up our second season, I'd like to thank all our listeners for sticking with us and spreading the word about the podcast. We really appreciate the support you've given us both in season 1 and 2. When we began the podcast, our aim was to interview international members of the life sciences community on topical issues that face us today as scientists, but more importantly as people. The idea was to create a space for mentorship-like experience that will hopefully be sustainable and will forever remain in the digital space for people to refer back to. The amazing podcast team have really enjoyed creating and bringing you such amazing guests and content. Today's episode will actually focus on the winners of the TDR Mentorship Contest from 2019 that I had the privilege of sharing the digital stage with. The idea behind it was to bring a global community together through a digital medium, to give us a sense of locality through common experiences. They all have such amazing, innovative ideas on increasing mentorship in different regions across the globe, including the Philippines and Bolivia, and we've invited them here today to share these programs with our amazing listeners. Who knows, maybe you'll even get inspired to start your own mentorship challenge or apply to the next TDR Mentorship Contest cohort. Here's Ella with the 2019 TDR Mentorship Contest winners.
Welcome to your Digital Mentor Podcast. I'm your host, Emmanuel Opon, coming to you from Manchester City. In this episode, we'll be connecting with Dr. Aguilar, one of the team members who also won the 2019 Mentorship Contest led by TDR SESH on how to improve research mentorship in low and middle income countries. Dr. Maria Aguilar is a senior pediatrician, currently professor in child growth and development research at the Medical College and University Mayor de San Andrés in La Paz, Bolivia. For the last 30 years, she has designed and implemented health and nutrition interventions for children under 5 years of age. She also led the confirmation of the Food and Nutrition Council in Bolivia and was the first national coordinator of the Malnutrition Zero program until 2012. Among many of her work and achievements, she's also authored and co-authored several articles on nutrition and child health and the description of nutritional transition in Bolivia. So welcome, Ana Maria. It's nice to have you with us today. Would you like to share a bit about yourself with our audience in addition to this introduction?
Thank you. Thank you very much, Ella. I perhaps will start by giving a brief overview of the working places. I'm researching at the University Mayor de San Andrés, as you said, in La Paz, and we are working with health staff who lives in the municipalities of Caripullo and Zacaca, located more or less at 7 hours by road from our place. Our central team is composed by Dr. Pamela Duran, who also works at the university, and Dr. Susan Rans, who actually lives in London, and unfortunately she cannot be present today, but she sends her greetings. Overview and motivation of our actually mentorship proposal has been delayed due to COVID-19 pandemic, and because of that we have to review the original application. In the first place, because the pandemic has significantly reduced our ability to visit the selected rural areas during 2020 and 2021.
Just so our audience have a bit of context, so this program was the proposal in 2019, and so can you give us just a bit of a background about it? So what does it entail?
Sure. The original application was a community-based mentoring to enhance competences and development of rural research teams investigating factors contributing to infant stunting. We did change the whole concept because both health staff and the communities in the municipalities were completely engaged with actions to prevent and treat COVID-19. In both municipalities, Caripullo and Zacaca, as in most other municipalities in Bolivia, were hit by the pandemic with many new issues.
In your proposal, you had wanted to bring the different stakeholders together, right, to work on the mentoring project. But as you're saying, since they're occupied, it was probably difficult to execute it in the way you had envisioned.
That's the whole thing. Because actually what we tried to do to actually engage different kind of professionals and traditional staff in the research, what we proposed was a bidirectional mentoring. The understanding of the cultural context on the one hand and understanding the whole scientific issues on the other hand. Any other subject apart from COVID-19, it was impossible to actually deal, I think, all 2020 and part of 2021. The other thing was we could not visit the places because at the beginning we were in a really rigid quarantine. But afterwards, all travels outside the cities were forbidden. So, considering that and considering the situation with the teams with whom we had contact always, permanent contact via Zoom, phone, and many things, we decided to actually see and review the situation and see what is important thing that the people in the municipalities want actually to know. And one of the things was how they confront the pandemic.
This is interesting. Initially, so the project was focused on mentoring, bringing a bi-directional relationship between different stakeholders, whether it's community health workers or the scientists, into tackling infant stunting. I really like sort of the flexibility, sort of really listening to the community, right? And then seeing what they want and then moving in that. And as you were saying, they wanted a way to tackle COVID within that moment.
So, I mean, the only thing was actually to see, and the topic, we were waiting the people in the municipalities to say, what is the topic you really want to address, in which we can help? And we actually figure out, because there were some topics, but there was one which the municipality of Sakaka was doing. At the beginning, the people, the communities, did not acknowledge COVID as an illness.
Was it due to misinformation or just a lack of awareness?
Both, I think. A lot of misinformation and also grasping the idea that some virus comes and will kill you and how you pass the virus from one to another. So as in many other settings in health facilities, what happened is that health centers and the health personnel were seen as the people who were causing the virus, as the people who were infected and passing the infection to the communities. So at the beginning, the communities, they didn't want to go to the health center. Not only didn't go, but they actually were hiding if they were ill, because it was such a heavy social burden that if you had COVID, it was so very bad indeed. So you didn't want your neighbors or whatever to know that you had COVID. So it was really no point of break between both parties.
In your proposal, the problem that you were going to face was a lack of capacity in multidisciplinary research. And so now that this focus has shifted, focused on COVID, or was it focused on COVID and the initial problem that this project had tried to solve, with like hierarchies in mentorship and a lack of multidisciplinarity in mentorship?
That's very interesting how you put it, because the first thing was to actually analyze what it happened. So Sakaka, one of the municipalities, have already devised an approach which was in a way successful. And the whole mentoring was to study that thing they did in order to pass on to other municipalities. And what they did, they actually, understanding the beliefs of the community, the cultural context, they devised a packet of herbs, of traditional medicine. And they actually put it together and say this is the COVID packet. So it was an incredible ticket to go into the communities, and also an incredible ticket for the people of the communities to come to the hospital, because they come to buy that thing, but at the same time they did the tests, they came for vaccines and other things that the health facilities do.
So this innovation of the COVID herbal medicine, was this a collaboration between the mainstream healthcare field and the traditional healthcare field in bringing this to fruition?
That's a very good question. In Bolivia, each facility has a traditional doctor. It's not a full staff, but always the municipality pays for a traditional doctor to be part of those. And the traditional doctor in Sakaka, he's very good. He actually not only knows that traditional knowledge, but also he is able to do creams from herbs, and also know very well, and he cultivates the herbs. So they have a place where they cultivate all those herbs. So it was there, as it was in many other municipalities.
Then what was the role of this project in facilitating this gap between the community and the healthcare? Did you work with the traditional doctor with the distribution of that, or was the role of this project to emulate what the traditional doctor had done into other municipalities?
That was it. I mean, our role in mentorship was to actually do the process with the team in Sakaka in order to understand, to organize what happened and what were the factors which made it successful in order then to make a packet. Which are in our way to do that, to make an article, to make some more readable things in the languages of the municipality, because the people in the municipality are trilingual. They not only speak Spanish, but Quechua and Aymara, which are the other languages. So, I mean, our role really was to translate the whole process of mentorship in order for the people in municipality of Sakaka to be able to acknowledge, to really systematize what they've done, because they've done just spontaneously, more or less. But it was really a very good thing. And it's a thing which could happen in many other municipalities, but it didn't. And we could see from systematizing the whole experience, but also for the team to be able to pack a thing and see how they would how this experience can be transferred into other municipalities. And so now we are in that process. And also the other thing is to find things, because the two municipalities are very, very close, but it didn't happen in Caripullo. They have their own traditional doctor, etc. And it happened. And we have to understand why. One of the things that happened in Caripullo is that traditional doctor died with COVID. Well, I mean, we don't know if that was a catastrophic thing, but anyway, I mean, because we're working with both teams, it's an interesting process of understanding, of talking to both things.
Are you using a similar mechanism in terms of how you had planned on implementing this mentorship project, which is now focused on COVID, but then looking at how such a spontaneous approach to bridging the gap between maybe a lack of trust, or you probably can offer a bit more context since you're analyzing why it happened and how it happened?
Actually, we're trying to follow the same steps because it's mentoring. And we're discussing, whether it's the subject is one or other, the steps of mentoring are almost the same. One of the approaches we had at the beginning, which was face-to-face interaction, that we couldn't do. So we actually tried to do as much contact but via other media. And in this transition, one of the things we decided to actually do is to improve the facilities for the people in Sakaka to have better phones, for instance. And for the small grant that we have from Colombia, we prioritize to buy that thing. And small phones with high power. It's very difficult, the internet connection.
So since you said you were doing like a systematic analysis of how such a phenomena came to take place with the COVID herbal medicine, my first question is, what sparked that spontaneity? Did you find it? Based on your analysis, what made the community so willing to accept the COVID-19 herbal medicine? And also, what is the plan of translating this approach to other municipalities through mentoring?
One thing we have to shift. We actually, instead of doing a quantitative research, we're doing a qualitative research. That was the first change. Susana Ranz is an expert on that. She has a doctorate on that, and she's very good in qualitative research. So the first thing was to actually, as you said, to explore and see what are the facts from the beginning, to understand how the people in Sakaka come to that determination. What was the analysis they've done? So we decided to do in-depth interviews via Zoom for the key people, with them analyze. I'm not familiar with that technique, but she's very good in doing transcribing, etc., and having the whole things. And that in itself, and we're in the middle of that now with the people, in that analyzing with the people.
Nice. So co-production of knowledge. That's really good.
Now, how actually to pick up, because we understand one thing, and I can say, that's the traditional doctor played a very important, but the people say, no, he's very good, but we approach it to some people in the community, for instance, which was crucial to deliver the thing. And I find that very interesting, not just the packet of things, but also the road, so to mapping the road, how to do in other things. That was the mentoring thing, no? I think, instead of actually doing the research we did plan to do, that was more or less kind of retrospective, interviewing and sort of understanding how was it.
So the phase now that the project is in is trying to understand how it came to be, the path that it took, and also you are working with the people who were involved to sort of understand that in terms of even analyzing the results or like the findings. So then after that, what is the plan with moving forward in terms of how you can potentially teach other municipalities a similar approach?
Well, I mean, we plan two things. One is to do a proper paper for a journal outside and a journal inside in Bolivia. And the second is to do a much more popular information for communities. We are planning to actually attend, there are many events in Bolivia which are organized in order to let everybody know municipal experience in different things. It will be one at the end of this year, in November, a meeting of municipalities where they choose a subject. And we are waiting for the call because they have the call for proposals, for instance, and they have the call for subjects. So we are waiting for the call and we're going to submit this. Probably we hope that this will be chosen as one because among the 300 municipalities, they chose like of 20 best experiences. And with this experience, they do a book every year, something like that.
So publish the workshop with the people in Bolivia, but also external, and also then sort of share the findings within municipalities. Then how will mentoring take place between municipalities? Are you going to get members of different municipalities to sort of learn about the approach that was found in Sakaka? So are you going to get members of the health professionals and representatives of different municipalities to sort of learn about this approach? Or now that everything has changed, the approach now is to just disseminate the knowledge as much as you can and then maybe develop a new plan from there? Or are you still going to be doing a mentoring sort of setup between, for example, a member of a municipality from one location and then another from another location to learn about the unique approach that was used in Sakaka?
Well, I mean, one of the things is that because of the mentoring is supposed to actually give the whole initiative to the people in Sakaka, our place will be to actually give all the follow-up things to the people in Sakaka, which it's one of the aims. They are already doing that. They are really very good in that. So if there is a presentation or whatever, it will be the team, the joint team, because traditional and the health center team of Sakaka who are going to deliver whatever we found. If there is interest, because that's also important, it's important to say that in Bolivia, the approach of medicine, the official policy in medicine is intercultural. Our system is intercultural. So I think that the health service will be a platform in that place. But in our role of professorship in the university, we always have a place for the people in Sakaka to actually give their lessons in our teaching structure. We do, for instance, a master's or diploma in interculturality. And that one is a very good is a very good approach, and probably we're going to film them for others. So in the way of disseminating, probably there are many ways of disseminating, no?
Yeah, and also the approach to mentorship is sort of different in terms of the people in Sakaka are the ones who are going to be leading the initiative in terms of sharing their knowledge, including students who are in masters or within their communities or with other municipalities that might be interested. And then now the role of this project is to understand how the approach came to be and then sharing that information with the country and then with the world and then with municipalities in the conference or the call that is going to take place where you can submit your findings.
One of the things that we with Susana and Pamela with is the effort will be to make the people in Sakaka to acknowledge the thing they did. That's so important, and to actually be able to systematize that. And if they could do that, they could do with other things that are happening, which we found very important.
Okay, this conversation has gone in a unique route, different from how I had anticipated, but still good in sort of how we can think about mentoring. highlighting some aspects of our conversation. There was a proposal that was focused on creating hierarchical sort of relationships in mentoring to ones that were horizontal and bringing more multidisciplinarity to mentorship and research, involving different stakeholders, where the focus was initially on child stunting, so infant malnutrition or child malnutrition, and then a complete shift of the project because that was where it needed to go. Going with that direction, looking at a phenomenon that has sort of bridged a gap between community and the healthcare workers and sort of understanding why it's so, and then finding ways that you can systematize it, but then giving the communities themselves the tools to themselves mentor others and also share their findings and also have a self-awareness that maybe other phenomena that are as good as that exist in some other places, and then using a similar approach to sort of see that. And then now your role is to first understand the findings and then share with people within the country and also outside of the country. So this is a different way that giving others agency to sort of mentor other people. So your role is sort of creating the space where others can become mentors themselves and then can mentor others, whether it's members in the Sakaka community who have found this and then creating the space for them to also be able to mentor others, whether it's coming to lecture halls and sharing their information with other students, recording, disseminating. So this is a really cool way of thinking about mentorship. Those were sort of the cool highlights that I got from our conversation. Is there anything that I missed? Maybe a lesson from this whole process of mentorship about this approach and your willingness and your openness to sort of pivot your project into a completely new direction? So any lessons or advice you want to give to other researchers, aspiring researchers about mentorship or sort of this project and your lessons from there?
Well, perhaps one of the things that really is a characteristic of the other colleagues, not like Susanna and Pamela, is they are very open-minded. Very, very open-minded and able to shift. Because, at that point, we actually said, we're sorry, we can't do that. No, that's difficult. We don't have money. We can't move. It's going to be a year or more. But they were saying, we keep going. We don't know what to do, but we keep going. We keep the contact with the people. We talk about the needs of the moment. Pamela, for instance, she is a doctor in laboratory. And during many months, she actually kept in contact with the people in Sakaka and Karipuyo, teaching them about the lab test of COVID, which was very important for them. So we built a connection. We didn't sort of cut it. We actually wait and see, maybe an opportunity.
So being open-minded, being flexible, listening to the people and what they need, and then trying to work with them to sort of meet those needs. So thank you for the work you do. You've done a lot of work in child malnutrition and also sort of mentoring, just so in case anybody's interested, they can reach out to you. So could you share with our listeners where they can find you?
I work at the University of San Andres in La Paz, Bolivia. And you have some of my phone number or my WhatsApp or that.
And so we've come to an end. Thank you for tuning in, and please follow us on Twitter at mentorship_podcast, where we will let you know when our new episodes are released. You can listen to us on YouTube, Spotify, Apple Podcasts, Google Podcasts, and SoundCloud by searching your Digital Mentor Podcast. You can also reach us by email. So please send your comments and questions to enquiries@yourdigimentor.net. As always, information on the episode and how to reach us will be in the description box, including how to connect with our guest, Dr. Maria Aguilar, and also links to more information and resources. And finally, our goal is for this podcast to be shared as a resource, so please remember to tell people about us.
Whether it's to find a mentor, be a mentor, or even start a mentoring program, there's no such thing as too many mentors. With that, I'd just like to say a huge thank you again for your support and hope you can join us for Season 3.
This episode is supported by Advanced Courses and Scientific Conferences, a program which develops and delivers training and conferences that span basic research, cutting-edge biomedicine, and application of genomics in healthcare. Through engaging and networking, the events educate, inspire, and transform careers worldwide.
This episode is also supported by the Wellcome Sanger Institute. It undertakes large-scale research that forms the foundations of knowledge in biology and medicine. It uses the power of genome sequencing to understand and harness the information in DNA. The Sanger's discoveries are used to improve health and to understand life on Earth.
This series was developed in collaboration with TDR Global. TDR Global is a worldwide community of passionate scientists and experts who have been working with TDR on research on infectious diseases of poverty. Some of their current global engagement efforts include the recent crowdsourcing contest with SESH, which engage researchers and educators in low and middle income countries to generate practical ideas to improve research mentorship at the organizational level. If interested in learning more, please visit their website for publications of their findings from this contest.